On this edition of the Best Docs Network featuring Forest Park Medical Center, Dr. Jorge Casas, Dr. David Genecov, Dr. Garner Newton, Dr. Jeffrey Cattorini.
And hi again, everyone. Jim Knox along with Candace Kruger, and welcome back to another edition of the Best Docs Network featuring Forest Park Medical Center. And of course, Candace, Forest Park Medical Center, the top medical center in the entire Dallas-Fort Worth area.
You bet it is, Jim. We're going to start off with our first best doctor who operates right here in Forest Park Medical Center. It's orthopedic oncologist, Dr. Jorge Casas.
Hip replacement surgery and knee replacement surgery are two of the most commonly performed operations every year. In cases where patients develop an infection around an artificial hip or an artificial knee, a lot of times these cases have disastrous consequences.
I had 2 knee replacements in 2011, and both times they got infected. I talked to the internist and said, what happens if I don't do any more surgeries? Because I was miserably sick of having my leg sliced open and having to go through the rehab and the pain and everything. And the internist says, well, you'll die.
He had undergone a knee replacement for a worn out joint. He subsequently developed an infection of his artificial knee. When I went back to replace his knee, the defect was so large that I ended up having to reconstruct him with a design knee replacement that I typically will use for the cancer patients. Because he had already had a previous 2-stage exchange, he had a relatively large defect to reconstruct. So he required reconstruction of a relatively large segment of his femur bone. I had to remove approximately 4 inches of his femur bone because it was completely eaten away by the infection.
It's 100% better than it was 2 years ago. In all, he probably saved my leg, and he could have saved my life too.
The good news is that there's no sign of any infection coming back. He's still having some pain and some episodes of swelling, but he's better now than he had been for several years.
I'm able to do most everything I could do before, and when I pitched the pain pills, everything changed too. It makes you feel a whole lot better. Everybody says, well, bedside manner, it doesn't count. You've got to be a good surgeon. Well, he's a good surgeon. He's an excellent surgeon, and he's also a good communicator. So there's no surprises, when you wake up from the surgery. You know what you were up against, and you know what you had to look forward to.
Radiology departments are very commonly in hospitals. The difference here is that this is primarily a surgical hospital, and our primary purpose is to support our OR. We've got 14 OR suites upstairs. We have both pre and post-operative imaging.
Here at Forest Park, I work more closely with the staff members, kind of the segue between the director and the technologist. I'm here with them daily, supervising what rooms they're in, what exams need to be done, what tech goes to what assignment.
We're a full-service outpatient facility. We have an MRI here that's called a short bore. What that means is it's not as coffin-like for patients. It's more open. We also have a CT scanner here. It's a 64 slice that is capable of doing cardiac as well as any other CT imaging that you might need. And it's also an interventional radiology CT scanner, meaning we can do procedures that normally would have had to have been done in another room and then brought to CT for scanning. We can do both on the scanner at the same time. We have an on-site radiologist from RCA that read all our imaging. We have an on-site ultrasound unit, fully capable of doing general ultrasound and vascular, and I also have a staff member that can do both.
Here at Forest Park Medical Center, we work closely with some of the best surgeons in the area. They're definitely top-notch. We do what's best for them, and we make sure that we have all of the equipment necessary, all of the reps that they need to make sure that they get the job done well.
Our surgery suite encompasses 4 C-arms that can be used in a variety of times during the day, and our primary OR tech, who happens to be our lead tech here at this facility, is Stephanie Woodley. And she has not only taken the bull by the horns here at this facility, but she's also trained each of the other staff members that work in OR and has done a phenomenal job in that capacity.
If we're doing spinal fusions, that screw placement is very important, and we need to make sure that those screws go in exactly where they need to be. And imaging has everything to do with that. If our image is wrong, then those screws could be placed incorrectly. So we work very closely with the surgeons to make sure that we have the right image that they need, to make sure that they can place the screws correctly in the spine where they need to be. We're actually imaging during the surgery and assisting the surgeon to make sure that he's guiding his tools into the right, proper anatomy to make sure that he's doing it where he needs to be.
I really firmly believe that we have state-of-the-art equipment here, and I've got a top-notch staff that can really meet any of the referring physicians in the community's needs.
Best Docs Network featuring Forest Park Medical Center. Welcome to the 21st century of cutting-edge medicine. Forest Park Medical Center.
I'm currently in the OR manager position. I oversee the nurses, our RNs, our scrub techs, all of the individuals that are necessary to smooth running of the facility in the operating room. Monitor the operating room schedule to keep everything running on time, as well as meeting the needs of our patients and our physicians. I decided very early on that I wanted to be a nurse. I enjoy people. I enjoy being able to serve the needs of others, and the operating room just really stood out to me. I think the OR is an area that's it's very scheduled, it's very routine. I like to be able to plan. One thing that really stood out about Forest Park was just the quality of patient care and just the way that the patients are treated. The physicians, everybody is just wonderful. The facility promotes patient satisfaction, patient care, which are all things that are very important to me, and it's a facility that I feel like I'm very in line with their values and what they view. One of the main reasons that physicians do enjoy coming to our facility is just with the extent that we do go to meet their demands and also provide them with what they would like for their cases. We want all of our physicians to have what they need to provide effective, safe surgery, but also to meet their preferences of what they would like.
I'd been having a lot of pain, mostly in my left shoulder and in my left back area for about a year. More and more, it was where I couldn't lift my left arm, and then I just started feeling some numbness and tingling in my arm.
Denise came to see us because she was having severe pain starting in her neck and traveling all the way down her left arm with some numbness and tingling and actually weakness, and it's been going on for quite some time. And she actually sought us out for minimally invasive options and options beyond the more traditional spine surgeries.
I went for about 8 weeks of physical therapy, and the pain kept getting worse. I did go see Dr. Masaccio. I did a lot of research on him about his outcomes and the minimally invasive technique that he did, and so after a lot of research, he was my top choice to go to for this procedure.
We did get an MRI, and her MRI showed that she indeed had herniated a disc and was pinching a nerve in her neck, and that was causing this pain and dysfunction in her arm. It was very troublesome for her. A good surgical option that we offered her was a posterior cervical foraminotomy from a minimally invasive approach. And what that means is from the back of the neck, we could go in with a very small incision and a small set of tubes to preserve the muscles and to limit the amount of tissue disruption to actually get to the spine and unpinch the nerve by removing disc tissue and small bone spurs that were pinching the nerve.
I love to ride horses, and that is one of my biggest passions, and it had become to where it was interfering with my ability to hold the reins. I think Dr. Masaccio was a little surprised that I put him on track for having the procedure, when the recovery was, and when I could get back on the horse. Immediately after the procedure, I did have feelings back in my hand, Each day it gets better and stronger.
And with the knee, she was back riding her horses within a couple months, and that's the most important thing and really satisfying for both the patient and myself that we could see a patient get better that quickly with such an easy process.
I feel great. Dr. Masaccio has been great. I go back for follow-up every couple of months, and each time it doesn't change. He is just as engaged in the treatment as what he was on the first time that I did see him.
BioLife started with this desire to kind of house or hold all this reconstructive material for our patients, so we only had to do the surgery once. Because you can take stem cells from fat and you can treat that fat and separate those cells out, we then are able to do that and also save those cells for future use.
I was 13 when I was diagnosed with Perry-Romberg syndrome, and ever since then I've had little surgeries here and there.
Angela has Perry-Romberg syndrome, and that is called hemifacial atrophy. It usually starts in early adolescence, and then slowly over time the tissue tends to just wither away.
My first 3 treatments with Dr. Genecov were mainly just building it up, starting from scratch, putting tissue into my face, and then he built on from there with adding the silicone bone to my chin, adding the donor bone to the side of my face, rebuilding my eye socket, my nose.
If we know we're going to operate more than once, we don't want to go back in and have to harvest all that fat every time. So now we have the ability not only to remove the fat and store that fat, but we can also take the enrichment, the stem cells and regenerative cells that exist within that fat, separate them, and then add them back to another aliquot of fat prior to the reintroduction or the grafting process.
He's put tissue and everything to kind of regrowth, and it just makes it so that my appearance is that I'm normal on both sides.
We use different kinds of things like bone grafts, or we sometimes need to cut the bone and move the bone, especially the lower jaw for the chin. But oftentimes we need to use fat or other tissue substitutes to build it back up. And that's why we developed this. Now it has application outside in orthopedics and cosmetic surgery and ultimately cardiac surgery and just general therapeutic issues. But it was started out for patients like Angela who have severe facial asymmetries who need repetitive operations. We can take that fat, store it, and then process it in such a way that we can better enhance their reconstruction later on, then everybody's a winner.
Of course, all of the doctors featured on our show are dedicated to changing people's lives. Like our next best doctor, it's otologist Dr. Hahn.
We were going down a back road, and there was a group of dogs that I could see in front of me, but apparently there was one left behind, and it came out of my blind sight, and when I finally saw it, I swerved. And when I swerved, it slammed me into 2 oak trees.
When Brittany came in to see me, she had a profound hearing loss in that ear from the car accident. Something associated with the accident affected the continuity of the 3 little hearing bones in her middle ear.
When I was in the hospital bed, if I was laying on my left side, my right side I couldn't hear anything. I think there's something wrong because I could hear perfect. Now it feels like my balance is off. I can't hear y'all when I turn my head.
I tell the patient that they have an option to repair their eardrum and repair the hearing bones within their middle ear cavity. And I go over with them the anatomy of the middle ear, and I talk to them about the fact that a surgery can be performed to look into the middle ear, see what the problem is, and at the same setting to repair whatever it is.
Dr. Hahn knew exactly what he was doing, and he was taking it one step at a time. He wasn't, okay, well this is what we need to do and then we need to do it now. He was doing it step by step by step. And the first step that Dr. Hahn took was taking an ear test. And when he had found out how bad the results were, that's when we started taking more steps towards getting surgery done.
I lifted up her eardrum, looked into her middle ear, and it was apparent that the second hearing bone had actually been misplaced off of the third hearing bone. So there was no connection between the second hearing bone and the third. When her eardrum would vibrate, it wasn't vibrating into the inner ear at all. We actually replaced her second hearing bone with a prosthetic hearing bone, and within days, she noticed a significant improvement in her hearing.
Amazing the results that I had. And ever since after the surgery, I mean, I've been just upscaling from there. If I knew someone who was having the same problem as I was, I would definitely recommend Dr. Hahn. He's a great physician, and he treats you like you're a person and not just another patient.
Ann was suffering from severe sinus problems, and she credits Dr. Colin Pero for helping change her life. To find out more about Ann's story and other life-changing stories, log on to bestdocsnetwork.com.
What we found is that there's a new technology for treating reflux that can get people off of their medications. The problem is, because surgery hasn't been used in 20 years or so, we didn't have a good way to evaluate the patients. Those centers were spread out throughout the state, frankly, and we decided that there was a need to have a center put together that could do all the different types of diagnostics that we need to identify reflux patients. Forest Park stepped up to the plate. They bought all the equipment. We got associated with some of the gastroenterologists in town that we hadn't done any work with before, and they've taken the lead to run the center, to do the diagnostics, and to give us the information we need to appropriately treat the patients. We do pH studies. We do pressure studies of the esophagus called manometry. We also do regular endoscopy to look and obtain pathology specimens. And the best test that we have now is called impedance. Impedance is a test in which we're able to actually measure the movement of fluid up and down the esophagus. So where the fluid may not show up in some of the other tests, for sure it's going to show up in this test. The difficulty that we had in the past was we were sending patients one place to get pH, another place to get manometry. We had to send patients down to Houston to get impedance. And so now having all that equipment in one space becomes very convenient for the patient. I think because there's so much information out there on the internet, on the TV, people understand that they have a problem. They have reflux, but they don't understand all the options that are available. When they come in to see me, I'm going to talk about their symptoms, how they relate to reflux, whether it may be due to some other disease process. We're going to talk about the anatomy. We're going to illustrate the anatomy to them in pictures. And then we're going to talk about the different tests that we need to do to confirm that this is actually what we're dealing with. And then we'll talk about surgery if it's indicated. And rather than having to send patients across the state to get that study done, it's something that we could do right here in Forest Park in Dallas.
As always, for more information on any of the doctors you've seen on today's show, just visit our website. It's bestdocsnetwork.com, and be sure to click on that Forest Park Medical Center tab.
All right, Candace, now time for our next best doctor, who of course operates right here out of Forest Park Medical Center. It's orthopedic surgeon Dr. Garner Newton.
The meniscus is a structure inside the knee that acts like a shock absorber. It's commonly injured with any twisting type motion. There are different signs and symptoms that occur when somebody tears the meniscus. The most common one is pain. It's usually on the inside or outside of the knee, depending on which meniscus is torn.
I was basically experiencing a lot of knee pain. Activities were limited because of the knee pain. I finally decided I had to go see Dr. Newton when the pain just became too much, and I felt like even with rehab, anything I did, the pain wasn't improving.
This is a model of the knee, and what it shows here are the two meniscus. This meniscus here is the lateral meniscus. It's on the outside of the knee where you see this small bone here, the fibula. The medial meniscus is right here. That's on the inside of the knee. The way these structures are torn usually is a sudden twisting type motion. When the femur twists on the tibia, that causes a tear. Once a patient's diagnosed with a meniscus tear and they've proven to have failed non-surgical treatment, then the treatment for a meniscus tear would be arthroscopy. That's simply making 3, maybe 4, but even sometimes 2 small incisions to go in there and trim that tear out. It's an outpatient procedure. It usually only takes about 20 to 30 minutes to do, and the patient for the most part is walking right away. I think the most important thing after somebody's undergone meniscus surgery is to try to prevent future injury to their knee in general. The way to do that is to keep up the therapy exercises that they've worked so hard with in those 3 to 4 weeks after surgery on their own, so that they're conditioned, they're dynamically stable, and they basically are at less risk of re-injuring that knee.
My husband and I live about 4 hours from Dallas, and it is every bit worth the drive to come and see a doctor such as him. You get great care with him. He cares about you. Like I say, he truly cares whether you recover, and I think as a patient you have to believe that.
Stephanie has a question for Dr. Pero. She'd like to know, can someone with severe allergies be helped with surgery?
A lot of patients have severe allergy problems, and many of them also have chronic sinus infection problems and or nasal obstruction. Sometimes those patients can be helped with surgery, and typically like to make sure that we have their allergies under as good a control as possible before deciding to proceed with surgery. In other words, the allergies themselves might be contributing to swelling in the nose, which could be contributing to blockage of their breathing, could be blocking the openings of the sinuses that lead to sinus infections. Our hope would be that we could treat the allergies by themselves, which would decrease the swelling enough to improve their airway and decrease the severity and frequency of the infections. In some patients, based on their anatomy, that's not possible, and those patients are ones that would benefit from surgical intervention.
About 10 years ago, I was having a lot of shoulder pain, and I had seen several doctors prior to that, and they told me that I had a problem at C6, C7, and I was looking at surgery and a possible spinal fusion. So I called my friend who works in critical care, and I said, who's the best neurosurgeon out there? And she gave me Jeffrey Cattorini's name. So I went to him. He said, your symptoms don't fit your MRI. Your MRI is wrong. And I had seen 4 previous physicians prior to that, and Dr. Cattorini is the one that caught it. I get emotional.
One of the procedures we offer here in the practice is insertion of a cervical artificial disc. We see patients aged 20 to 55 who have a soft tissue disc herniation or one-level disc disease. They typically present with one-sided neck pain and arm pain.
He came and sat right down next to me, and he showed me the artificial disc and the way it worked and the way he would screw it in. And I said, you know what, that's a metal disc, ball and joint. That makes sense to me. You know, I didn't like the idea of pulling bone out of my joint or out of my hip and then fusing my neck, and I have limited range of motion. That just didn't make sense.
The good thing about the artificial disc is not restricting movement, it's keeping movement. And there's no need for a cervical collar post-op, or there's no need for a bone growth stimulator post-op, because you do not want to promote a fusion.
And I woke up from surgery, the pain that I had had for over a year was gone, and I just bawled. So right after the surgery, I was out there playing tennis immediately with absolutely no pain. Best decision of my life.
Nancy did great post-op. She returned to her activities. She's actually referred friends from out of state for the artificial disc, and she's very happy with the result, and she's got great range of motion.
Go to a neurosurgeon. They're meticulous, and especially go to Dr. Jeffrey Cattorini, because he's outstanding.
Did you know the spacious operating rooms at Southlake Forest Park Medical Center will feature the latest technology, including the ability to live stream video from surgeries to nurse stations and other Forest Park campuses. The Dallas location has an auditorium where doctors can gather to watch a surgery. Don't forget, for more information on any of the outstanding doctors you see on today's show, head to the Best Docs Network website. That's bestdocsnetwork.com and click on the Forest Park Medical Center tab. Right now, it's time to head to our next best doctor operating here out of beautiful Forest Park Medical Center. It is plastic surgeon Dr. Ricardo Meade.
Courtney is a classic revision breast augmentation case that had had a series of failed operations.
Sometimes it could be painful, especially lying down. Not wearing a bra was not an option for me. I would even sleep in a bra 24 hours a day, always wore underwire.
The planning was intact. It's her tissues that were just structurally not sound. And if you need to reinforce tissues, then using this product will completely change her outcome.
With Dr. Meade, he was very confident, he was very kind. This has obviously been something that's been very self-conscious for me. So I felt very comfortable in talking about the issues with him. I felt confident that he knew what he was doing, that he had experience in doing this. And even after my consultation, his office staff was wonderful in trying to accommodate everything and make sure that this surgery could be possible for me.
It's almost like a push-up bra that you can't see in there. So at this point, I've figured out, I think, right where it needs to sit. I've been very happy with those results. In Courtney's case, it was a home run. I mean, the problems that she came to me with, although previously would have been problems where I might have just turned the patient away and said, I can't help you, I don't have the skills needed for this. With the problem list that she came, I knew I just check-marked each one down the line. I thought, we can fix this.
I'm still in recovery somewhat, so I have to be a little bit careful, but I'm back to running. I can stand up and feel comfortable, and not only has my self-esteem drastically improved, but I feel like I'll actually be able to do things like a normal person.
With this product, I can reposition the breast implants, and that's an opportunity for her to change out her breast implants. Maybe she did saline, wants to switch to silicone.
The first time I actually saw the finished results and I took the bra off, I couldn't be happier. I mean, I was just ecstatic, and this procedure has drastically improved my lifestyle. I'm much more comfortable. My self-esteem has improved, and I couldn't feel better.
Best Docs Network featuring Forest Park Medical Center. Welcome to the 21st century of cutting-edge medicine. Forest Park Medical Center. Today's Ask the Doctor comes from Sarah. Sarah has a question for Dr. Richard Hahn. If I do liposuction, will I gain more weight in other areas?
Liposuction is permanent removal of fat cells, but you're not removing all the fat cells in the area that you treat. So what liposuction does is give you a relative reduction of fat in an area relative to any place else. Let's just say that I have 100 fat cells in my tummy and 100 fat cells in my thigh, and I've taken away 50 of them through liposuction in my tummy. I have a new ratio. Instead of 1 to 1, it's now 0.5 to 1. Or it's twice as likely that I'm going to gain fat in the thighs as opposed to the tummy. So if you take in more calories, where is that weight going to be displaced, or where is that fat going to go? It's going to go preferentially to the thigh than to the tummy. Liposuction itself is not the reason that you're gaining weight or fat in one area. It's because you're taking in more calories.
That'll do it. That'll wrap up another edition of the Best Docs Network featuring Forest Park Medical Center, of course, the top medical center in the entire Dallas-Fort Worth area.
And for more information on any of the doctors you've seen on today's show, just visit our website. It's bestdocsnetwork.com, but be sure you click on that Forest Park Medical Center tab.
And if you have a question or comment for us, we'd love to hear from you. Send us an email at info@bestdocsnetwork.com.
So long, everyone. We'll see you next week.